Rachel, are you with us?
I am, yeah.
There you are.
Hi. Here I am.
Good afternoon, everyone, and welcome to our Together We Talk.
Sorry.
You're all right, don't worry. You're on and off.
Well, that'll be me. Always causing trouble.
But you're there. Welcome, everyone, to, I think, episode 4 of our Together We Talk podcast. And today we've got Rachel Elven from Whitworth Medical Practice, who is going to be chatting to us all about diabetes. So welcome, Rachel.
Hi, good afternoon.
Do you want to just take a couple of minutes to introduce yourself and then we'll get started?
Yeah. I've been a nurse now for going on 27 years. No, I know I don't look like it, but I have. And for the past 8 years, I've been working as practice nurse. So during that time, I've done a lot of extra training on lots of the chronic disease management that goes on within general practice, particularly diabetes, which is why I think I've been nominated for this one. So I did a diploma in diabetes management, and then we've gone on to do additional training with the diabetes, looking at things like, so now I initiate insulin and things in practice as well with some of our type 2 diabetics that are pretty straightforward. So yeah, have fun and yeah, having a ball in general practice.
Yeah, good for you. And then we chatted a bit earlier, and I think I'm really looking forward to this. You're a bundle of energy, and I'm really passionate about Rossendale and local community, and doing stuff like this that's just part of the jigsaw of trying to help people to live a healthier lifestyle, perhaps prevent serious illness, and just trying to help people manage the situation that they're in. So I think it's worth saying at this stage that we're going to be discussing some general principles today, some general advice, and discussing some of the topics around diabetes. This is not designed to be, health advice for anyone in a particular circumstances. And we'll maybe pick up some questions as they come in on Facebook and different things where we can. But I guess, and we'll be asking you your opinion. But obviously, people, if they're worried about something or they're unwell, should contact their GP.
Absolutely. Obviously, every diabetic is going to be different, and everybody's, the way that we deal with each patient is different. It should be individualized. So yeah, absolutely. So just general terms about sort of things that you can do to improve your health as a diabetic, and hopefully, for a lot of patients, the option is there to reverse the diabetes. So yeah.
And I'm excited to come on to that. We're going to kind of work our way through some questions, but that's the message of hope, isn't it? That we can, these are things we can do something about. And so first of all, just to kind of get us started, what are some of the kind of warning signs that someone might be diabetic, or that we should be looking out for, that might be an early warning signs of type 2 diabetes?
I think in the early stages, as blood sugars start to rise, symptoms can be quite insipid, and you may not even notice them, and they are actually just picked up and they come as a complete surprise whilst you're having blood tests done at your GP surgery. As the blood sugars get higher, then you may notice things like if you cut yourself, that it's taking longer to heal, that you're prone to getting infections. The ladies might get thrush more frequently, or you just seem to be run down, getting infection after infection, feeling tired. And then you start to get onto the really classic ones where you're feeling particularly thirsty and drinking an awful lot and passing an awful lot of urine, along with unexplained weight loss at that point. And usually by that point, you've got really quite high blood sugars going on. But I think if you think that you're at risk of developing type 2 diabetes, and Diabetes UK have got on their website, a risk calculator. If you find that you're in a high risk category, certainly contact your GP surgery, and you could arrange to have a blood test to have that checked. That's easy enough done.
Okay, that's really useful, I think. And if someone's experiencing those type of symptoms, or some of them, you've mentioned contacting your GP there, is that the standard route? Is that the first port of call that people?
Yeah. Absolutely. Unless you are feeling, unless symptoms come on, obviously we've got to remember sometimes patients can develop type 1 diabetes, and those symptoms will come on quite quickly. And if they're not treated, because it's a completely different thing where they're not producing any insulin at all, then there is a real risk of them developing a condition called ketoacidosis. So they will become unwell quite quickly. And obviously out of hours, then you start ringing, you start appearing at, you present your urgent care really, and get looked at as well. But as I say, that is very different to a type 2 diabetic, which we're sort of concentrating on today.
Yeah, sure. So if diabetes is, we've mentioned, if diabetes is not treated there, what impact does that have? Why is it so important that we identify and manage some of this?
Right. Well, other than the symptoms that can develop as your blood sugars get higher, there are risks involved with having those raised blood sugars. So part of our diabetic checks is making sure that patients are, we're keeping a close eye on them and making sure that these things aren't necessarily occurring. So one of the things that can happen is that it can affect your eyes over time. So your eyes can start to develop little crystalline deposits at the back of the eye from the little blood vessels at the back of the eye leaking. So our diabetics will have an annual review of their eyes. They'll go and have what we call diabetic eye screening each year. Increased risk of cardiovascular disease. So your risk of having a heart attack or a stroke with a diagnosis of diabetes is the equivalent of somebody that's already had one. So, that's a significant risk. So a lot of what we're doing in general practice around medication and blood monitoring is about sort of trying to reduce that risk as much as possible. Because, at the moment, we've got a lot of younger patients being diagnosed as diabetic. You can develop chronic kidney disease, again, from the raised sugars. So some of our long-term diabetic patients, ending up on dialysis can be a problem for them. So again, it's about kidney monitoring, blood pressure monitoring, and again, losing sensation to feet, altered circulation to your hands and feet, and a particular one for the men, although I know I'm very aware that we're talking in the afternoon, is that they can develop erectile dysfunction as well, which can be a problem for men with diabetes. So yeah, there's a whole plethora of things that can go wrong. But the problem is that these things happen gradually. And once they've happened, you can't reset it. You can't send it back to where it was. You're trying to sort of maintain it at the point that we've picked it up.
Yeah. And so I guess the early identification and then the management of diabetes is so crucial then to avoid.
Absolutely paramount. So especially for patients, if you get an invite to come in for your review, come on in. Obviously, COVID has caused major problems for patients being able to access their reviews this past 12 months. But the practices in the Valley, we're all working now to try and, work our way through our patients. We're going to probably aim at our higher risk patients first and work our way through, but we will get to everybody.
Good stuff. So in terms of managing, then let's move on a bit to kind of that we've kind of covered some of the sort of, not the doom and gloom, but this is why it's important to manage. So
absolutely.
If we come on to management, then what are some of the key, obviously for some patients, when they go and see their GP and they go through the diabetes pathway, there may be medication involved, but if we take that as kind of a given, what are some of the things that people can be doing proactively in their life to try and improve their diabetes or even reverse type 2 diabetes?
Yeah, absolutely. Well, I think with the raised cardiovascular risk, the absolute first thing you should do is, if you are a smoker, please just quit. The support out there, you've got the Quit Squad, it's medication to help you. So, that is going to further raise your cardiovascular risk, and it's just not worth the chance, really. So, yeah, first of all, quit smoking, and then it's all the usual stuff that you just think, oh, she's on it again. Looking at the amount of alcohol that you're drinking, because you can be taking in an awful lot of carbohydrate and sugars through that. Looking at your diet, and I know that we're going to sort of look at that a bit deeper, and also looking at the amount of exercise and keeping active, and it doesn't have to involve tight lycra. So you can there's lots of things that you can do to help bring those blood sugars down and reduce your risks.
Yeah. And I think, for me, obviously, I work with Leisure Trust, and physical activity and exercise is what we're really passionate about, as well as kind of broader health and well-being. But I think your point there about physical activity doesn't need to be you know, doesn't need to be running marathons and going to the gym or even playing organized sports. It might be regular walking, it might be riding your bike with the kids, it might be playing cricket with your children on the field. It can be low level, family based activity.
Absolutely. And we know that exercise has been proven to reduce people's blood sugars. So ideally, after you've had a meal, 30 minutes after eating, you know, going for a gentle walk, it is just perfect, you know. And we know that exercising has what we call a legacy effect. So it'll make you more sensitive to your blood sugar. It makes you more sensitive, your insulin more sensitive. So your blood sugars come down, but you have this legacy effect that can last up to 16 hours after exercising. So, you know, it's not just what you do at that moment, it actually influences what your blood sugars are going to look like over the coming waking hours that you're awake or whilst you're asleep. So yeah, it's certainly worth doing.
Yeah, didn't realize that. That's really interesting. So in terms of, is there any, in terms of exercise then, we've talked about that, we're going to come on to diet into a minute. In terms of exercise, is there any specific, you know, we're talking mostly about type 2 diabetes. Is there any risk factors with exercise? Is there anything people should be aware of in terms of exercising too much or not, you know, is there?
For type 2 diabetics, with the exception of those that are on insulin or a medication called glyphosate, then there is, you know, if they're on other medications for the diabetes, it's completely safe to exercise. And it, as we've already said, it doesn't have to be leaping around, you know, really getting a sweat on, you know, just getting out in the garden and doing a bit of digging, you know, doing a bit of that gardening, going out for a walk, walking your dog, all those things sort of count. So no, you know, if you're worried, if you've got underlying other health conditions, then by all means speak to your GP. And I know for some of our patients, they may have things like fibromyalgia that make exercise difficult, you know, but just getting out of the chair when the adverts are on while you're watching your telly of an evening and moving around for 5 minutes, you know, that will have an effect. So definitely worth just, you know, it doesn't have to be all in one go.
We've had a question come in from Val on Facebook who's watching at the moment, and Val's put, how possible is it to turn it around and to be no longer in need of medication? Is there a story of hope here for people?
Yeah, absolutely. I think that what you've got to remember with type 2 diabetes, you could subcategorize your type 2 diabetics. So there is a group that there is less hope for, let's say, and those tend to be my elderly patients who have a normal body weight, and that their diabetes is more about their pancreas not being able to produce the same amount of insulin than it did when they were 20. And then you've got the younger diabetics that have been diagnosed probably in the 40s, 50s, 60s, who are still quite, you know, generally fit. And for them, yeah, there's a real story of hope that looking at your diet, looking at where the foods that are pushing your blood sugars up, looking at you know, your activity levels and things, and just changing your lifestyle. You don't have to change it all in one go. Doing one thing and getting that to be a habit, and then add it and just building on it week on week is absolutely the way to go, because we know that if you do it and it becomes habitual, you're going to stick with it, you know. Whereas if you get up on Monday morning and go, right, that's it, I'm never eating carbohydrates, not eating chocolate, no potatoes for me, I'm going to swim on a Monday, Wednesday, Friday, I'm going to run Tuesday, Thursday, Saturday, it ain't going to happen. You know, something will come up and it won't happen. And then everything falls apart. It's not just that one thing. So yeah, there's lots of hope out there for diabetics that they can do a lot to reverse this themselves.
Brilliant. Okay, we're gonna pause there and do our feature, our overrated, underrated. So this is where we pick up a few kind of hot topics in the world of diabetes.
Okay.
This is absolutely your personal opinion, and there's no offence caused by anyone who has a different perspective. But just trying to pick up some things. So I'm going to share my screen, and we're going to go through a couple of topics and ask you to say whether it's overrated or underrated, or whether it's kind of about, you think it's about right. So
yeah.
Let's see if we can get this to work. Okay, can you see that screen now?
Yeah, I can see that, yeah.
Okay. So first one, low GI diets, overrated or underrated?
I would actually say they are underrated. I think there's a lot of people out there that don't really understand what a low GI diet is. It stands for glycemic index, and it's talking about the speed at which your body will absorb the carbohydrates in foods. And obviously the more slowly your body absorbs them, the slower the effect is on your blood sugars. So you get rolling hills rather than mountains when you get your blood sugars. So yeah, definitely underrated.
Okay. Next one, insulin pumps are a hot topic at the moment. What do you think?
Again, this is looking more at your type 1 diabetics who are having to monitor their insulin needs over their exercise and what they're eating. So yeah, underrated. They really are, as that picture shows, they're getting really small now. They're amazing.
Yeah, cool. Glucose tablets?
Absolutely, 100% overrated. Carry some jelly babies if you need sugar. The more exciting.
Okay, I like that. Low cal beer.
Oh, definitely overrated. If you're gonna have a drink, have a drink. But you know, it's like everything else. It's in moderation. You don't take the carbs out. It doesn't taste as good.
Okay. Carb counting.
Carb counting. It's one of those that actually it's for type 1 diabetics who are, injecting their insulin and trying to keep good control. It is absolutely essential, really. And if they've not been taught how to carb count, their GPs can refer them in that direction. For type 2 diabetics, you don't need to be carb counting in that sort of way, as we're going to touch on low carb later on. So a bit sort of on the fence on that one. It's great for some people, but not so for others.
Okay. Specialist diabetic foods.
Absolutely, 100% overrated. They'll give you bellyache, they'll give you trapped wind, and they'll give you diarrhea. Fab. No. Everything in moderation. Stick to the ordinary stuff.
That's a strong no for those.
Absolutely.
Medic jewelry.
Interesting one. For patients such as type 1s who are at risk of maybe having a hypo and not having anybody around them that knows that they're having a hypo, that they have an underlying condition, because you can come over as looking quite drunk at the point that you start experiencing hypo symptoms, then yeah, I think they're a great idea. Type 2 diabetics, not every type 2 diabetic would need a warning. Yes, if you're on insulin, then absolutely, we always give patients an insulin passport as well to carry around with them. But yeah, type 2, you don't need to wear one unless really you're on insulin that would cause a hypo. So bit on the fence with that one. Okay. Don't know. I think personally they're a bit overrated.
I like
you can carry that sort of information in your wallet. Someone's always going to have a rummage around your pockets if you've collapsed, start to see who you are and try and find an extra kin detail. So yeah.
I like that you were partly sat on the fence, but then you've committed.
Yeah, committed.
I like that. Okay, diabetic socks.
Diabetic socks. Well, as we said earlier, one of the problems is that you can get changes to your circulation and sensation in your feet. So diabetics frequently complain about having cold feet. Whether I pay the extra money for ones that say that they're for diabetic feet is another thing. I think so. I'm going to go with that. They're overrated. You just need to buy a pair of socks that aren't too tight around the ankle, that fit well, and probably thermal if your feet are on the cold side. Brilliant.
Love it, Rachel. You've gone all in there, and I'm happy with that. I think that was our best one so far. Good for you. Yeah. All right, let's thank you. That was fun. Let's spend the last part of our time together then today talking specifically about diet.
Okay.
And we've mentioned that a couple of times so far. So in terms of diet, just talk to us a bit about why that's so important and some hints and tips for people who might be struggling.
Well, as a lot of people know, that I link up a lot with Emma Gladwin-Field, and a few years ago we went to a lifestyle medicine conference, and I think for both of us it was really life-changing in the way that we approach our patients and healthcare. So one of the things they were showing us was that in the late 70s, early 80s, that the dietary recommendations for this country changed. So in 1981, we went to a version of the Eat Well plate that we all know now. And over the years, that Eat Well plate has changed slightly, but it's really strange that the carbohydrate portion of it keeps increasing. It's up to about 37.5% is what they're recommending. So the real emphasis went on to eating healthy whole grain carbohydrates, and that fat was the enemy. So everything went low fat. Things when you take fat out of things, it loses its taste and its mouthfeel. So what they put in its place is more sugars and emulsifiers and things to give it that mouthfeel back. So I think what's happened is we've ended up really sort of concentrating on these healthy carbs, and there's evidence to show that on the whole, you know, we're eating pretty much what's on that Eat Well plate. It might not, our carbohydrate might be a bit more on the sweet side, or you know, but on the whole, we're eating pretty much that. But 40 years down the line, we've got a real epidemic of obesity and an epidemic of diabetics as well. So a lot of what we're looking at with diet around diabetics now is reducing the amount of overall carbohydrate. I think it's really interesting to note that carbohydrates can only be turned into sugar, and they can't be used for anything else. Whereas, you know, you put yourself into a diet mode and you're burning body fat, your body can turn that fat into sugars, you know, and it can do the same with proteins as well. So we don't need as much carbohydrate in our diet the way that we do. And I think historically we've always thought about diabetics being a bit of a touch of the sugars, you know, and that they're not to have sugary sweets or treat sugar in the tea and coffee, no puddings, no sweets, very boring. But we're still sort of promoting rice and potatoes and bread and pasta, albeit brown, because the whole wheat was better for us, but it's not helping, you know, that's still getting the calories in that way and still getting the carbohydrates, which are pushing the blood sugars up. And you just can't, there comes a point where you just can't produce enough insulin to deal with it.
So that's really interesting then. So they kind of, so for someone like me who perhaps doesn't know much about diabetes at all, I'm exactly where you've described there: sugars, sweets, chocolate bars. But actually, that our societal cultural move to quite a high carbohydrate diet is probably a bigger part of the problem.
Yeah, and we say that you know, you watch the adverts and they'll say, you know, it's whole wheat, it's good for your heart. Sorry, Ken, I didn't tell you I've got this here, but I measured out just before I came online. Let me just see if I can move my camera. Yeah. That is 30 grams of fruit and fibre. Well, of a morning, that's barely anything, and that's a standard cereal bowl, so it doesn't amount to much, but that will break down to about 5 teaspoons of sugar, if not slightly more. I think that with David Unwin's done some infographics, so if you're interested in how much your cereal is going to affect your blood sugars, definitely have a Google for David Unwin and sugar infographics, and there's lots of them out there that he's done. But yeah,
interestingly for me, so I a little while ago I started to try and lose some weight, and cereal was one of the things that I looked at. So we eat lots of cereal in our house, as I'm sure many families and households do. And yeah, the kind of recommended portion size for cereal, I measured it out and weighed it out, like I'm probably having 4, 5, 6, 7 times more cereal.
Yeah, absolutely. Absolutely. And I know with the cornflakes is a real one, because cornflakes are really popular. People think, oh, just made with corn, they just flattened it and dried it out, it's fine. But actually that 30-gram bowl will turn into about, you know, it'll have the effect on your blood sugars of about 10 teaspoons of sugar, which is massive, you know, so not all cereals are equal. But of course, then, you know, as we said, that was a little handful of cereal. You know, you probably have 3 of them. So I'd be having sort of the equivalent of about 14 teaspoons of sugar for breakfast. So looking at things such as, you know, having fruit with full fat yogurt, you know, because sometimes when you look at these yogurts, they've added all sorts to them on the side as well. I think the most interesting one was some creme fraiche I picked up one time, picked up the low fat one, read the label, they'd actually added semolina to it. Yeah. So they'd taken the fat out, but they'd added carbohydrate into it. So it's still going to have an effect on your blood sugars now, because you've taken what you thought was the healthy option. So yeah, sometimes it's just easier to go for unprocessed foods, go for it the way that God intended it to be, you know, natural, unprocessed. The more processed it is, the chances is that it's going to have more effect on your blood sugars.
Yeah, no, thank you. I mean, and so important, that we, I work in this kind of health and well-being space, but so important that we are taking individual responsibility for kind of learning about some of these things. I didn't realize how much sugar there was in cereal until you've explained it there, but also like what the recommended quantity of there's something about
you've got to
quantity
read the
really
packet.
important as well.
Yeah, and sometimes these manufacturers will give you a portion size and you read it, you think, oh, it's not that bad. But when you actually look at the portion size, it's not, it's like my wine bottle last night. It said that there was there were 6 glasses in it. Well, there wasn't, there was 4. It depends on how you portion that out. So yeah, absolutely. You need to be looking and possibly even per 100 grams and working it out for yourself as to how much there is in things.
And that does take a bit more effort, and it takes a bit more time. But I think, as we've talked, if you then think, oh well, I can't really be bothered to do that. But if you think back to 20 minutes ago when we're talking about the longer term outcomes here, reduced life expectancy, problems with your eyesight, circulatory issues, serious fatigue, those types of things.
Yeah,
actually a few minutes thinking a bit more carefully about your diet, and actually it's, in some ways, it's thinking about it once or twice, because you can set yourself into a bit of a route. If you spend a few hours thinking about it, you can build a bit of a routine, can't you, that you can then stick to for several months.
And it's just changing. You could say that one week you were just going to look at your breakfast and you were going to look at alternatives to eating cereal. You can go down the chia seeds soaked overnight if you want to. It's like frog spawn, I have to say, but it doesn't taste as much, so it's what you add to it. So you can do that, or you could just say, I'm going to have scrambled eggs. How long does it take to make a couple of scrambled eggs? Or suddenly the things that you missed that you've been told were terrible for you, having a bit of bacon and egg isn't quite as bad as you thought it was, particularly for your blood sugars anyway.
Yeah. Excellent. Wonderful. So we're just going to pick up a couple of questions that have come through from members of the public.
Right.
One of them is, what's the best way to reduce the HbA1c? I'm on Slimming World and I've reduced mine from 42 to 40. Is that low enough?
Well, first of all, fantastic. Well done for reducing your HbA1c. Let's just explain to everybody what a HbA1c is. It's a blood test that we do. It's a marker on a red blood cell that tells us what your blood sugars have been up to over the past 8 to 12 weeks. So unlike a fasting glucose, that if you've been really good for a couple of days, you can cheat, because you can drop your blood sugars. You can't really cheat a HbA1c unless you're committed for 12 weeks. Yeah. So it tells us what you've been up to on average. So a normal HbA1c would come in between 20 and 41. And that's somebody that's not in the normal category. You get your pre-diabetic impaired glucose tolerances, as they're medically referred to, between 42 and 47. And then 48 and above is deemed to be diabetic. Okay, so if you get your blood sugars below 48, we call it diabetes in remission. You've put your diabetes into remission. We refer to it as that rather than cured, and you're no longer diabetic, because if you go back to the way you were dealing with it before, the blood sugars will go up. So the other thing was about Slimming World. Slimming World have got these free foods that you can eat, and they promote them. You can have as big a baked potato as you want, and you can have as much rice and pasta. And for some strange reason, they've restricted bread. I mean, bread can be a big issue for a lot of people. So things like bread have been restricted by Slimming World. Slimming World group leaders should have a leaflet on diabetes that they should be giving out with all the other information to diabetics. And what it's basically saying is you need to watch your portion sizes. A carbohydrate, starchy carbohydrates such as potato, rice, pasta, is only a chain of sugar. I always say to patients, it's a chain of sugar molecules all stuck together. When you eat it and your body starts to digest it, those bonds break and you end up with sugars which are absorbed then and push your blood sugars up. But certainly a lot of the super free foods that we talk about, a lot of the low carbohydrate vegetables, so your greens and your salady type things, even your carrots and so on, broccoli, those foods, really use those to fill up on. Use your protein that's also free foods to fill up on, because that'll keep you feeling fuller for longer, but really just watch that amount of carbohydrate that's going in. but well done on reducing your HbA1c. 40, you're in the normal zone there, and just keep it there. It's brilliant.
Keep going, doing what you're doing.
Yeah.
And then a couple of questions then. I think we can probably pick up at one in one go around appointments, diabetic specialists, self-referral. Like, what if you're worried about, if you've either got diabetes or you're worried that you might have, what should people, is it mostly, I think we've touched on this, but is there advice to generally contact your GP and get yourself booked in?
Referrals into secondary care to diabetic specialists. We tend to refer those that are quite complicated. They may have ongoing kidney issues going on or other illnesses that are affecting. So quite often, if you're a fairly straightforward diabetic, in as much as you're not complicated by other issues, or we're really struggling to get on top of your diabetes, we'll try and manage you in primary care. Sometimes, if you're looking at it from a lifestyle point of view, some of the places we can refer you to the dietitian for some support there. We've got the lovely Jo, our life coach, now working with us in Rosendale. There's another portfolio there. If you're newly diagnosed, then there is an Empower diabetic education that we use. So sometimes it's just not, it's not just about being referred to secondary care. I think that there are so many diabetics now that, there was a real pressure on that service. So once again, primary care have taken some of that pressure by being able to start patients on things like GLP-1s, such as Victoza, which is an injectable therapy. It's not an insulin, but it's an injectable therapy, and we can do that in-house now.
And I think, no, it's a really good point. That I think sometimes, we perhaps envisage that we'll get to see specialists or others, which sometimes is absolutely needed, and that's the right thing. But as we've talked about today, there's a lot that you can do to help support and manage the condition yourself. There's a lot of support within our local GP practices and connected services, and as well, and lots of support like the Up and Active scheme and others within the community, where people can offer support around exercise or diet, mental health, those types of things as well.
Absolutely. As I say, I always say it's not everything. You take one thing and you run with it, and once you're comfortable with that, then you add something else in. And as fast as GPs are happy to prescribe medication, because we're looking at your blood sugars and we want to introduce those risks, you reduce your HbA1c, you reduce those blood sugars, and we will take that medication back off you, because we're going to save a fortune. So yeah, absolutely.
Fab. Well, I think we've covered all of our main topics there, and we're probably time's ticking on. Is there anything that you'd like to leave as sort of a takeaway, key message, or you sort of top 1 or 2 tips for people who have got type 2 diabetes or diabetes in general?
I think firstly, get moving. If you're able to move, get moving. Doesn't have to be half an hour all in a go. There's a wonderful example. A couple of years ago, the BBC and ITV did a few programs around really low calorie diets. And on 2 consecutive days, they kept an eye on these people that were living in this house on a 800 calorie diet. And they monitored their blood sugars. And one day they were left to lounge on the sofa feeling sorry for themselves because they were barely eating anything. And then the next day, every 30 minutes, a klaxon went off and they had to get up and move for 5 minutes. The blood sugars on the day that they had to move every 30 minutes for 5 minutes were significantly lower than the day that they laid around doing nothing. So it doesn't matter, if there's something downstairs that needs running upstairs and putting away, go do it. Just those little things, they will all add up. And then from a diet point of view, it's not all doom and gloom. If you really watch those starchy carbohydrates, you can still have the sweet treats. It's about learning to build them into your diet. And I think that if you're a diabetic and you really want to really use yourself as your own experiment as to how foods affect you, and most of the nurses are now going to jump on me, but I would do this. If you come for your diabetic review and you say, I'd really like a machine, and we don't give them out very often unless you're at risk of having a hypo. But if you're willing to take on that machine and then contact the manufacturer and buy the strips, which are about £10 for 50, and you buy your own strips to go with it. You can go exploring, you check your blood sugars before you eat and 2 hours later. And I always say to my patients, try everything, what you'd normally eat, what you think you should be eating. Go and have a greasy curry, you know, go and have your naan breads and your rice and see what happens. Because I think seeing the numbers come back and hit you in the face as to what you've done is the biggest. I can tell you week after week, month after month, but when you can see what it actually does to you, I think that's a really, really key learning thing that we can use. And I think we should use it a bit more often. I know I tend to use it with my patients that are keen to have a go. But as I say, there's that outlet, because the CCG won't let us prescribe strips and things. You will have to buy the bits that go with it. But, you know, 10, 20 quid, certainly worth a bash.
Yeah. Wonderful. Rachel, thank you so much for being with us. There's been some nuggets of advice in there, and hopefully that's helpful to local people. And again, you know, the final message, I suppose, if you need support, then ask the right people for it and contact your GP surgeon. They'll be able to link you up. So
yeah, absolutely.
Thank you very, very much. We're gonna close there, but we you know, thank you, and we look forward to perhaps having you again in the future to discuss some more things.
I'm sure I'll be back. I'll get nominated.
Yeah. Right. Thanks.
Thanks, Ken. It's been a pleasure.